Since the call was made to open the community isolation facility, we've been very touched by the spontaneous offers of support and help from all walks of the public and private sector. They have actually made a lot of sacrifices both to their family lives and their professional lives.
Openings CIF has been a very, very challenging experience, but a very meaningful one. We would like to thank all our nurses from all over the sector, like HPB, nurses from National Skin Centre, we have nurses from Thomson Medical Centre, and not forgetting the big group of our nurses who are in the private practice, who willingly join us and be part of the team in this crisis. And we'd like to really thank you for your commitment and stay safe.
The shift is about 12 hours. So it's 8 o'clock it's 8 a.m. to 8 p.m. Normally we will be in the full PPE, meaning the protective equipment. So we will be wearing glasses. Usually I tape down my glasses because my glasses will fly everywhere and we cannot touch our face to adjust our glasses. After that, we will wear goggles as well as the N95 mask on top of a lot of other protective equipment like the gown as well as the hairnet.
So even though that we don't have any nursing background, we are actually given a one-day training where we learn how to wear and degown the PPE properly, and we learn how to do swabbing. And most of the skills that we pick up is actually when we do hands-on, like doing triage, doing admission, and taking the vitals of the patient.
Language is definitely a main concern because sometimes they don't understand us. So we have to do our best to try to facilitate them. Sometimes I will just write simple English on their paper so that I can give it to them. Then sometimes they use Google Translation to help to facilitate.
So when I stepped into the hall and they actually know I can talk Tamil, they were actually very happy because they have someone to clear their doubts. They feel at home because they can talk in Tamil and all that. So I was actually very happy, and we nurses are actually trying our level best to make them feel at ease. But we are assuring them that they are actually kept safe here. They have all the facilities here, from showering, food, a place to rest. We have free Wi-Fi for workers who have to call back their family, back in overseas and all that.
The main challenge would be to manage my own fear because understandably we are all human, and even as doctors we are not immune to the coronavirus. So we need to be extremely careful to make sure that we don't take the virus out and not get infected ourselves. The other challenge would be that we would have to be in the protective equipment for many hours, and that is also something that we need the stamina to be able to continue in the shift and make sure we do our best for the patients.
Initially, my family was very worried and anxious for me when I have to take up this duty, especially because I have a 15-month-old son. Let's say we make sure that our infection control is proper, then everything is actually quite okay.
I fortunately have a very supportive family. My mom told me, just go for it. If you can, just go, because people there actually need you. And we are nurses for a reason. We are being passionate. So when they need us in this kind of pandemic period, just go. We are pretty well geared up. We have facilities to shower and go and all. So they are actually taking good care of the nurses. For nurses out there, if they really can come down to help us, we will really feel very thankful.
So what keeps all of us motivated in honesty is that we all work together as a team. There's so many of us from different disciplines, different support sites, that we all want to work together towards a common goal, which is helping with this pandemic at this current moment.
Stay safe during this pandemic and stay at home as much as you can.
I just would like to say that we are here at work for them, and we want them to stay at home for us.
So I think in this current period, what's most important is, number one, we need to keep ourselves safe and healthy. We need to do our part to help in this fight. Everyone has a role in it, no matter big or small.